My name is Colleen Kozovic.
Slow down a bit, please, Colleen. That's what I was doing. Thank you.
Is that better?
Thank you.
And my question is to the Mental Health Minister. When we refurbish or revamp these new mental health units, have we given any thought to having carer support workers within the hospital setting as they do in Western Sydney Liverpool Hospital? That works very well. That way we get the families at the ground and the first initial time that maybe they will come into the hospital setting. Then in turn we can then refer them on to other services outside, for example, the NGOs.
Colleen, can you tell me where you're from?
I actually work at Uniting Care Mental Health.
Yeah.
Last year, though, I've only been there for 12 months. Last year, I did work in Liverpool Hospital as a support worker. As only, I believe, two, the other lady and myself, who were family mental health support workers for, families when someone enters the mental health unit. And it works very, very well.
Yeah, exactly. If I can make a couple of comments. Some of our hospitals and some of our mental health units around the state do have accommodation for families, particularly in rural areas, but also here in the city. Liverpool, I think you mentioned. One of the reviews of the acts, and if I can refer also to Andrew Constance, who's the Minister for Disability Services, is that under the Carers Recognition Bill that we put, or the Charter of Rights actually he put forward, was that carers have much more say in how care is dispensed to their loved ones, whether it be somebody living with a mental illness or somebody with a disability. And I think you'll see much more in that space over the next 12 months, where collaboratively people will have much more choice in where their care package goes and how it's spent. In terms of acute facilities, there aren't too many redevelopments that I'm aware of that are not taking that issue into consideration, but knowing the work that you do with Uniting Care and the great job that you do in Western Sydney, more than happy to have that conversation if it's a local and a more specific location. Some of the hospitals do have off hospital site accommodation as well.
Sorry, I'm not talking about accommodation. What I am actually talking about is support workers being inside a hospital unit.
Sure, right.
As well, my previous position was we would be in a unit, we would be able to go down to the mental health unit, speak with carers, go to tribunals, certain things like that.
Yeah, support people.
What I'm finding now is there are quite a few hospitals that aren't, should I say, receptive to having support workers in a mental health unit.
Yeah. Amanda might say something, but just again, I'd refer you to where we're going with this, because it's important people are supported in the system. And part of the role of the carer, whether it's somebody paid as an NGO or a family, have tended to be in the past left out based on issues around privacy. Now, we've crunched through all that, and we want to make sure that people that are entering into particularly the acute system, that it is a shared model. So whether it's carers, more importantly, people that sometimes don't have family or loved one to support them, which is probably where you're coming from, it is an issue, and it is to an extent an LHD issue as well. So I might ask Amanda to comment on that.
Just another response, please. Thank you.
Can I just clarify with your question? You're talking about family carer support workers. Yeah,
That's correct.
yeah.
It's not actually consumer. We have consumer support workers in our hospital setting, absolutely wonderful. But we have a lack of family support workers in the hospital setting. And as we're building the new mental health units, when we built Concord, which was quite a few years ago now, I was at the opening, but there was no facilities put in place when the unit was open to have a support worker in the unit, which is a shame.
And in terms of the planning of the unit also. That's what you're talking about?
Yes.
Yeah. So at the moment, as you said, we've got consumer support workers, and in terms of the family support workers, we really do that in conjunction with NGOs rather than within the service itself. So can we take that on notice in relation to the redevelopment that we're looking at, especially around the subacute beds at Liverpool, in terms of what the staff build of that will be, and we'll take that on board?
Yeah, Liverpool have the support workers.
Yep.
Campbelltown is getting a new mental health
Yes.
unit, and as I heard, Blacktown as well. So if, to put in place, I am a family representative for Uniting Care Mental Health, so I do a lot of promotional work in, with other services and that, but sometimes they're not receptive to what, I was going to say what we want to do, the way we'd like to put things across.
Yeah. And also you're saying about building in within the facilities, the places for that to occur. Look, I take that on notice, absolutely, but in terms of the needs of families and families' input into care, into the delivery of care and how care programs are developed, the families are a very important part of that, so I take that on board tonight. Okay, thank you for that.